I am Dr. C.L. Venkat. What are the different conditions in diabetes that affect the kidneys? Number 1, diabetic nephropathy. This will set in for people who have got long-standing diabetes. That too, who are not following dietary precautions and the medication is not taken regularly. Improper medication, irregular medication leads to damage of the kidney. This is called diabetic nephropathy. How to detect diabetic nephropathy? Urine examination, we may find urine albumin, in urine red blood cells, and if we do blood test, serum creatinine, normally it will be 1 milligram, it goes up. Ultrasound examination of the kidneys, if it is done, some changes will be found in the kidneys. So, if the diabetic nephropathy advances further, they may need few of the people in the long term dialysis. For this, for diabetic nephropathy, there is an Ayurvedic medicine. It is prepared from leaves only. That is called Punarnava, manufactured by leading brands like Dabur, Baidyanath, Jandu and Patanjali. If these tablets are taken one in the morning, one in the night, it helps in reduction of serum creatinine level and helps to reverse the diabetic nephropathy. This Punarnava tablet is available in Ayurveda shops. However, along with the allopathy medicines, this Punarnava also can be taken. There will not be any cross reactions between allopathy and this Punarnava. It is only prepared from leaves and it is quite harmless medicine. Number 2, there is a blood vessel supplying blood to the kidney, that is called renal artery. A clot may form in the artery or the fat may accumulate in the renal artery. Thereby, the blood supply to the kidney will come down. Once the blood supply to the kidney comes down as a result of partial or total obstruction of blood supply to the kidney, the blood pressure BP may go up and the size of the kidney will come down. It will shrink and the functioning of the kidney will come down. This deposition of fat or clot occurs because of increase of bad cholesterol and LDL cholesterol and increase of triglycerides. So we have to keep in normal limits LDL and also the HDL, higher levels of HDL is desirable. Number 3, in diabetics, infections are very common. Infections can occur in the urinary bladder, that is called cystitis. Infections are common in the kidney, that is called nephritis. The infections in the kidney, if they are not recognized early and if the person is neglecting the treatment and is taking irregular treatment without following the diet control, then it may be a life-threatening condition. So the infections in the kidney could sometimes be very dangerous. The pus forming in the kidney may end up in spreading to the bloodstream and then going to the brain also. Number 4, effect of diabetes on the urinary bladder is called diabetic cystopathy. There may be an urge to pass more times of urine. Sometimes it will be less times. Sometimes some of the diabetics, they do bedwetting without their knowledge, they pass urine. There will be severe burning of urine while passing. That is because of urinary tract infection. There is one tablet called pyridium. While you are passing, severe burning, to reduce that pain while passing urine, pyridium, Pyridium, pyridium tablet, one in the morning, one in the night taken, it relieves that pain. But this pyridium tablet, if you take, the urine color may be brown or orange or red. That is because of pyridium, when it comes out of the urine color changes to brownish or reddish color. So these are all the effects of uncontrolled diabetes, who neglect their diabetes by not taking the medicines regularly, and though they are diabetics, though they are advised not to take sugar, jaggery, honey, still they consume. The diabetics should never take sweets. Still, some people cannot give up the habit of consuming sweets. So, if you don't respect the diabetes, then all these kidney, urinary bladder problems will come. People who follow meticulously the diet control and perfect timely medication, they will never get in their lifetime the complications pertaining to the kidney and urinary bladder.